Hi guys, ATIF here, North City Physio. Hope your day's going well. Look, in the last few days, we've been talking about and showing you guys shoulder exercises to do with mobility and strength. So today, less of an exercise video, but I wanted to talk to you about one of the main presentations we see in the clinic and one of those conditions which can be a real mystery to us, and that's the frozen shoulder. So if you've ever had any progressive stiffness in your shoulder, maybe you think it's painful, it limits your movement or your range of motion, and it just like came out of the blue, out of nowhere. Well, firstly, I want you to contact us, okay? Because you may well have a frozen shoulder, but we need to get you assessed and looked at to rule anything else out. But if you've been having the symptoms of a frozen shoulder, you can expect some of the following symptoms. So frozen shoulder is a condition where your shoulder, specifically the capsule, which is like the sheath that is around the shoulder, which is like a ball and socket joint, becomes inflamed and it becomes progressively stiff. So there's a heap of research happening all around the world with frozen shoulder, just because we actually don't know in some patients why it comes on, because there is no real clear mechanism of how patients hurt it or how they injured their shoulder. Whereas for others, there's definitely a cause, like they've had some sort of trauma, they've had some sort of injury, and it can even happen after you've had shoulder surgery for sure. So what we commonly see is one or more of the following symptoms when it comes to frozen shoulder. So what we see firstly is a painful arc of motion. So what that means is as you're lifting your arm, it's going to go through a bit of a painful arc, and it can be quite sore. You may move it forwards and you may move it sideways. You might have pain at both rest and you might have pain at activity as well. You're going to get progressive stiffness. The joint's going to get tighter and tighter. And then that's going to impact on your daily activities, such as reaching, such as dressing, combing your hair. Any of those sort of examples, just your everyday activities are going to become more and more difficult for you. So if you have any of these symptoms, I do really want you to get in touch with us, and then we can have an assessment and see how we can help you. So just click the link in the description and we'll be able to have a chat. So guys, we know in frozen shoulder, there are 3 progressive phases. Now, the length of these phases could be really long, they could be really short. It's very, very individual. So the first phase typically is where the shoulder is painful, okay? Normally patients describe pain in the deltoid area, so that's sort of the front and the outside part of the arm. But often we do find that normally the range of motion is actually okay. It's really good in some cases, but there is some pain starting to develop just at rest as well. So that's your painful phase. Your second phase we know is the freezing phase. So as you can probably guess, this is where people would start to notice a progressive loss in their shoulder range of motion. So at this point, their activities of daily living, which they do every day, start to become a real problem and become extremely difficult to perform. Some people even start feeling pain right down as far as their wrist as they get a bit of referred pain down from the shoulder. So in this phase, the freezing phase, the shoulder does cause a lot of problems in terms of your function. But then we move on to the third phase, and that is known as the thawing phase. And that's when your shoulder should actually start to feel a lot less pain. And you should notice that you're getting a range of motion returning through this phase. But with good physio, with good sort of management, with good pain management, you can really start to feel the benefits of that management with your exercises, with your physio, with your pain relief. And you should notice that the pain and your function really starts to return back to normal. As I said, frozen shoulder is a very complicated problem and can be so when we don't know what caused it. So the sooner you get onto it, the better. So guys, there you have it. A bit of a summary on frozen shoulder today. If you think you have a frozen shoulder, I really want you to click the link in the description and we can have a chat and see if we can help you guys any further. So I hope you've enjoyed this video. Stay safe. Click on the link if you need to contact us, and we'll be more than happy to have a chat and see if we can help you. But until next time, it's bye for now.